I'm Tony Goldberg. I'm a professor of epidemiology at the School of Veterinary Medicine at the University of Wisconsin-Madison. And I'm also the Associate Director for Research for the University of Wisconsin-Madison Global Health Institute. I've run a project, a long-term project, in Kibale National Park, Uganda for about 15 years. There was a really dramatic outbreak of respiratory disease in the Kanyawara chimpanzees of Kibale National Park. Respiratory disease is emerging as one of the primary causes of death in wild chimpanzee communities across Africa. Chimps are coughing and sneezing and dying very quickly, and we really don't know, in most cases, what's causing it. We got these samples from Betty, the adorable chimp who died at 2.2 years old, and we were able to run those samples through the virus hunting protocol that I developed in my lab. It was an absolutely smoking gun clear result. The virus that was spread all throughout Betty's respiratory system is a virus called rhinovirus C. Used to be called human rhinovirus C, but it is one of the most common causes of the common cold in humans worldwide. But until we found this virus in Betty, this virus had never been found outside of humans. It was considered an exclusively human virus. What we found was really disturbing. Every single chimp we examined had only the variant of this receptor that makes humans exquisitely susceptible to the virus. So we can say with some degree of certainty that chimpanzees across Africa, everywhere, are susceptible to infection with what we now know is a deadly virus of human origin. This virus must have entered the chimpanzee population, and the chimpanzee population must not have had immunity to it. So it spread like wildfire, and it was able to replicate inside the chimps in a way that killed many of them. We're very certain that this is a virus of human origin. This is a reverse zoonosis from humans to chimps. The virus is genetically indistinguishable from its closest human relative. It's almost identical. So there is no vaccine for rhinovirus C or for any rhinovirus. This is the cure for the common cold would be a vaccine for these rhinoviruses, and we haven't found that. So there could be vaccines developed. There was recently a paper that came out for a new vaccine strategy that seems to be broadly protective against rhinoviruses in macaques. That kind of research is still going on. So if we are able to develop a broadly protective rhinovirus vaccine, and if we're able to show that this rhinovirus is a widespread cause of respiratory disease in chimps, vaccination would be possible. Now that's controversial. Some people really are against vaccination of wild chimps. Some people are for it. My own view is that these viruses are things that we're bringing to them, and we should at least consider it as a strategy. But certainly in zoos and in other settings, in captive settings, it would be very useful to have this rhinovirus vaccine.